Today we're going to talk about an important topic, doctors. When should you go to see a doctor? Knowing when to go to the doctor can depend on various factors, including the severity of symptoms and the specific situation. As kids, there is a schedule as when you should go to the doctor. As adults, there are no recommendations as when to see the doctor, so let's talk about when you as an adult should see a doctor. Emergency situations. If you or someone you know is experiencing a medical emergency, such as severe chest pain, difficulty breathing, sudden loss of consciousness, or severe bleeding, it is important to call emergency services immediately, 911 in the United States, or go to the nearest emergency room. For non-emergency situations, your primary care doctor should be your first point of contact. They are familiar with your medical history and can provide comprehensive care for a wide range of health concerns. If you have a regular primary care doctor, it is generally recommended to reach out to them for non-urgent issues. Urgent care or walk-in clinics. Urgent care facilities or walk-in clinics can be appropriate for non-life-threatening conditions that require prompt attention but do not require emergency care. Examples include minor injuries, mild illnesses, or conditions that cannot wait for a scheduled appointment with the primary care doctor. Persistent or worsening symptoms. If you have symptoms that persist, worsen, or are causing significant discomfort, it may be advisable to seek medical attention. This can include symptoms such as high fever that doesn't improve with over the counter medication, severe or prolonged cough, persistent pain, or any other concerning symptoms that are not resolving on their own. Chronic conditions or ongoing health issues. If you have a chronic condition or ongoing health issues, it is important to follow up with your doctor as required. Regular checkups and monitoring can help manage your condition and prevent complications. When should you see your primary care doctor? You should see your primary care doctor for various reasons. Routine checkups. Regular checkups with your primary care doctor are important for preventative care and early detection of potential health issues. These visits allow your doctor to assess your overall health, monitor chronic conditions, and provide appropriate screenings and vaccines. Management of chronic conditions. If you have a chronic condition such as diabetes, hypertension, or asthma, regular visits to your primary care doctor are essential for ongoing management and monitoring of your condition. Your doctor can help adjust medications, provide lifestyle recommendations, and address any concerns or complications that may arise. Acute illnesses or injuries. When you are sick or have a minor injury, your primary care doctor can provide appropriate diagnosis, treatment, and guidance. They can address common illnesses like colds, flu, infections, and minor injuries, saving you a trip to the emergency room or urgent care facility. Medication management. If you are taking medications, your primary care doctor can monitor their effectiveness, adjust dosages if needed, and address any side effects or interactions with other medications. Regular visits allow your doctor to ensure that your medications are appropriate and safe for the specific health needs. Health counseling and guidance. Your primary care doctor can provide valuable health counseling and guidance on various topics such as nutrition, exercise, stress management, and preventative measures. They can help you make informed decisions about your health and provide resources for healthy lifestyle choices. Referrals to specialists. If you require specialized care for further evaluation, your primary care doctor can refer you to an appropriate specialist and coordinate your overall health care. They can help you ensure that you receive the necessary follow up care and communication with other healthcare providers involved in your treatment. How often is a checkup recommended? The frequency of checkups with your primary care doctor can vary depending on factors such as age, overall health, and specific medical needs. Here are some general under 50 years old and in good health. If you are under 50 years old and in good health, it is generally recommended to see your primary care doctor every 3 years for a checkup. Over 50 years old. Once you reach the age of 50, it is typically recommended to see your doctor for an annual checkup. Regular checkups become more important as you age to monitor your age related health conditions and to address any concerns or changes in your health. Chronic illnesses or specific health issues. If you have a chronic illness, such as diabetes or COPD, or if you have a specific health issue that require ongoing management, more frequent visits to your primary care doctor may be necessary. Your doctor will determine the appropriate frequency of visits based on your individual needs. What are the benefits of regular checkups? Early detection of health issues. Regular checkups allow your doctor to detect potential health issues before they become more serious. Through physical exams, screenings, and discussions about your health history, your doctor can identify signs of diseases or conditions that may not be obvious to you. Preventative care. Checkups include preventative care measures such as vaccines, screenings, and counseling on healthy lifestyle choices. These measures can help prevent or detect health problems early, increasing the chances of successful treatment and reducing the risk of complications. Establishing a baseline. Regular visits to your doctor help establish a baseline for your health. By monitoring your health over time, your doctor can better identify any changes or abnormalities that may require further investigation or intervention. Personalized care. Through regular checkups, your doctor becomes more familiar with your health history, lifestyle, and specific needs. This familiarity allows for more personalized care and tailored recommendations to support your overall well being. Building a strong doctor patient relationship. Regular visits to your primary care doctor help build a strong patient doctor relationship based on trust and open communication. This relationship can make it easier for you to discuss personal health concerns, ask questions, and seek advice when needed. What are the most important checkups? The most important checkups can vary depending on individual circumstances and risk factors. General health checkup. A general health checkup, which may include a physical exam, medical history review, and basic screenings, can help establish a baseline for your overall health and detect any potential issues early on. Cancer screenings. Regular screenings for various types of cancer, such as breast, cervical, colorectal, and prostate cancer, can help detect cancer at its earliest stages when treatment is most effective. Blood pressure check. Regular blood pressure checks are important to monitor your cardiovascular health and detect high blood pressure, which is a risk factor for heart disease and stroke. Cholesterol level check. Regular cholesterol level checks can help assess your risk for heart disease and guide lifestyle modifications or medication if needed. Diabetes screening. Screening for diabetes, essentially for individuals with risk factors such as obesity or a family history of diabetes, can help detect the condition early and initiate appropriate management. Immunizations. Keeping up to date with recommended immunizations is crucial for preventing infectious diseases and protecting your health. Mental health checkup. Regular mental health checkups, including discussions about emotional well being and any concerns or symptoms related to mental health, are important for overall wellness. Are certain screenings more beneficial to me? Individual risk factors. Assess your individual risk factors, such as family history, lifestyle exposures, such as smoking, and personal health history. If you have specific risk factors for certain health conditions, you may need more regular screenings for these conditions. Age and gender specific screenings. Take into account age and gender specific recommendations for screenings. For example, women may need regular mammograms and cervical cancer screenings, while men may need prostate cancer screenings. Should I consider genetic screenings as well? Genetic screenings can be beneficial in certain situations. Identifying genetic risks. Genetic screenings can help identify specific gene variants or mutations that may increase your risk of developing a certain disease or condition. This information can be valuable for understanding your personal health risks and making informed decisions about preventative measures. Guiding preventative measures. Genetic testing results can guide preventative measures, such as lifestyle change or medical interventions, to reduce the risk of developing certain diseases. For example, if you have a genetic predisposition of certain types of cancer, you may be advised to undergo more frequent screenings or consider risk reducing strategies. Reproductive planning. Genetic testing can provide information about the risk of passing on genetic conditions to your children. This knowledge can help you make informed decisions about family planning and considering options such as pre-implantation genetic testing or prenatal testing. Personalized treatment. In some cases, genetic testing can help guide personalized treatment approaches. For example, certain genetic tests can determine the effectiveness of specific medications or help identify targeted therapies for certain types of cancer. Psychological and emotional impact. It's important to consider the potential psychological and emotional impact of genetic testing. Test results may bring relief from uncertainty or help individuals make informed decisions about their health. However, they can also lead to anxiety or emotional distress especially if the results indicate an increased risk of developing a certain condition. When should you start seeing a specialist? The decision to see a specialist depends on various factors, including the nature of your symptoms, the recommendations of your primary care physician, and the specific medical condition you may be experiencing. Lack of improvement. If you have been following the recommended course of action from your primary care physician but are not experiencing improvement in your symptoms, it may be time to consider seeing a specialist. Specific medical conditions. Certain medical conditions may require specialized expertise or accurate diagnosis and treatment. Your primary care physician may refer you to a specialist if they believe your condition would benefit from expert care. Specific medical conditions. Chronic or complex conditions. Chronic or complex conditions that require ongoing management may warrant consultation with a specialist. Specialists often have in-depth knowledge and experience in managing specific conditions. Referral from primary care physician. Your primary care physician may refer you to a specialist based on your assessment of your symptoms, medical history, and the need for further evaluation or specialized care. It's important to note that the decision to see a specialist should be made in consultation with your primary care physician. They will evaluate your specific situation, provide guidance, and make appropriate referrals based on their expertise and knowledge of your medical history. Depending on the healthcare system and the specific specialist, there may be waiting times involved in scheduling an appointment, such as urgency, availability, and the severity of your condition may influence the timing of your specialized visit. Important to note, I am not a doctor. These are only recommendations found during research and the use of AI. I hope this video has been informative. If there is a video you would like to see, please leave it in the comments. Don't forget, like, share, and subscribe.